4 and 5 will be played by only two teams. So individual rounds, rules of the rounds will be informed at the start of the rounds. So this is the big picture, okay? So the big picture works like this. For example, round 1 we are having 4 teams. If one team scores the first place at the end of round 1, they will be given a chance to answer a question from the big picture, okay? So big picture consists of 12 connection images with the background big picture, okay? So 12 connection images. For example, so this is the big picture, okay? So it has 12 numbers starting from 1 to 12, okay? So if one team answer one image, that image will be removed and background image will be revealed. So at the end of each round, if you keep on picking the connection images, the background image keeps on revealing. So it is having a big picture behind, it is a clinical picture, okay? So at the end of round 1, the first team that comes is about one connection image. At the end of round 2, you could choose 2 connection images. At the end of round 3, 3 connection images. At the end of round 4, 4 connection images. At the end of round 2, I have told you, one team will be eliminated. No. So that team will be awarded one last chance. So they could select one connection image and could guess one big picture diagnosis. Can you get me? So the team which is eliminating will be awarded one connection image. So that connection image, for example, at round 1 itself, if you find out that big picture, you will be given 160 points for diagnosing the big picture behind. Okay, it means that it will be very tough. The big picture is very tough. So you could guess. Every round you could guess. No negative marks for big picture. Okay. For connection images, the left hand side and right hand side has single picture connection image. The center has 2 picture connection image. So if, for example, if only one picture, you have to identify that picture. That is one picture connection image. You have to correlate 2 pictures and you have to find out a diagnosis. It is 2 picture connection image. So if you select one picture connection image, you will be getting 10 points for that connection image round. If you select 2 picture connection image, you will be getting 20 points. So this will be happening simultaneously at the end of each round. Okay? Apart from the main rounds that we are having. Okay? So we'll straight away start with the round 1. So round 1 is create a bomb, Oppenheimer. Okay? So what is basically Oppenheimer does? So 1942, Los Alamos, he was recruited for the Manhattan Project. So the topic for this round is the Manhattan Project. Okay? So at the Manhattan Project, there were a lot of theoretical physics present. Okay? Why Oppenheimer was preferred over others? Because he has some of the special practical approaches and he has that knowledge to create an atom bomb. So that's why US government recruited Oppenheimer and also he succeeded before the Nazis. Okay? The thing is, 4 clinical, so the rules for the round 1 is, for all the 4 teams, same clinical scenarios. Okay? For all the 4 teams, you will be given 4 clinical scenarios. All these 4 clinical scenarios, you will be given 60 seconds. You should be... So you will be given a rough paper, okay? So you will be given 4 clinical scenarios. You have 60 seconds to read those 4 clinical scenarios, okay? At the end of 60 seconds, you will be displayed, you will be shown 8 instruments separately. Okay, I will come to your table. I will show a 8 set of instruments. Okay, you should pick 4 instruments from that 8 set. Okay, so for those 4 clinical scenarios, you should pick relevant instrument. Okay, so for example, if you are picking 2 instruments from here now, that should correlate with the clinical scenario. You can't be picking three instruments from the same topic. Okay, I hope you get it. So out of 8 instruments, you should choose only 4 instruments. Okay, then all will be given chance. Okay, so you should read out the instrument which you selected, and you should justify yourself why you picked that particular instrument. I repeat it. First 60 seconds, you will be given 4 clinical scenarios for all the teams same time. Okay, at the end of 60 seconds, I will come and give you 30 seconds to pick 4 clinical instruments. Okay, so you should write down the instruments by number 1, 2, 3. Okay, so which instrument you are picking, you should write out in your paper. Okay, so all of you have a pen, right? Then I will be starting from team A. Okay, you should justify yourself, and you should, if you are correctly picking 4 instruments now, you will be awarded 40 points. Okay, at the end of that, you will be given a bonus question. If you answer the bonus question correctly, you will be given 20 points. The bonus question can be a pass question. Can be a pass question. Okay, so the pass question team can get 10 points. Okay, so we'll start with round 1. So time starts now. So these are the 4 clinical scenarios that you have been given with. So you should note down these clinical scenarios and you should pick the instruments accordingly. Okay? I'll start with team A. So time starts now. I can't be projecting this to the audience because these three teams will know what instruments I'm projecting. So we have given 4 clinical scenarios for the 4 teams, and we have given 8 set of instruments. So these are the So these are the 8 set of instruments we have given for the teams. Okay. So each team has picked 4 instruments among these. Okay. So they should justify why they have picked that instrument, and they should answer accordingly. Okay. Fine. Fine. Okay. We'll start with team A. So what are the Please don't change path. Okay. Please be honest. So team A, what are the instruments that you have chosen? So we have chosen number 1, okay, then 7, 4, 2, okay, fine. Now, so other teams you can spell out what are chosen. So first. So I'll play the video, okay? So team B, what instrument you have chosen? 1, 3, 7, 4. Okay, So I'm going to play the video, okay? So each team will be given their chance, okay? So for the first clinical scenario, a patient comes with a history of ear obstruction and ear blocking sensation. For that, the diagnosis is ear wax. Okay. So this is the first instrument that have been used. Okay. Otoscope with single speculum. So just observe the video. I'll ask questions. Okay, fine. So you should use a Hartmann process of one body scope for that. So this is foreign body removal from the nose. You could use either a foreign body forceps or a Hartmann forceps for this, Tilly's forceps for this. So finally, tongue depressor. So this is tongue depressor. Okay? Fine. So first, 2 The answer is for first question, second instrument. Okay? For okay. So the first team A Team A, for first, can you explain what you have chosen and why you have chosen? Team A, please explain for clinical scenario number 1. For clinical scenario number 1, what instrument you have chosen and why you have chosen? You can come over here and speak. We discussed about parental shows jobs from hilarious patients and seconds scope with dramatic or autosclerosis to check the ability of the human. That question they are not mentioned by the here are. So their answers are for year 1 they have guessed it as parental, so the diagnosis is wrong. Okay. So I'm giving 5 points. 5 points for team A for guessing the instrument correctly. Team B, for question number 2 they have guessed the instrument correct, diagnosis wrong, 5 points. For third one, again I'm giving 5 points. For fourth one, I'm giving 10 points. So team B, so what is the diagnosis for first question? Number 3. Please, students, write it down. Diagnosis instrument name. That's all. Write it down. Diagnosis. So 20 points. So they have all of their diagnoses are wrong. Okay. So the instruments they have found out 1, 3, and 4 correctly. Okay. So I'll just read down. For the first one, the diagnosis is correct. Johnson is correct. 10 points. For 2, the diagnosis is correct. Okay. So instrument is wrong. 15. So totally 15 points Third, please write it down. If you don't write it down, no, I will not. Four. Thank the person. So 20 points. 20 points. Give your sheet. So the first thing they have diagnosed correctly, earwax, Jobson broke, correct, 10 points. Second one, so labyrinthitis or labyrinth, so it can't be labyrinthitis, it is bone erosion caused by, so cholestoma causing labyrinthine fistula. So that otoscope with the bulb is, what it is called? What test? The test is called? So fistula test is correct. The third one is foreign body of nose. You have chosen tonic nasal speculum. Okay, correct. The fourth one is tongue depressor. What tonsillitis? What tonsillitis? So wrong. 35 points. So I have given points for that. Tongue depressor 5 points. Cholestoma 5 points. 20. Third one kena soalnya. 25 points. So round 2. So the winner of this round is team D. Okay. So team D will be given a chance to reveal the big picture.
சர்டிஃபிகேட் வந்து மேம்கிட்ட இருக்கு. மேம் சர்டிஃபிகேட் வாங்குங்களேன். மேம் கிட்ட இருந்து சர்டிஃபிகேட் வாங்குங்க.
So this is the first big picture. So you can choose one connection image, either from left hand side, right hand side. It's a single image connection. Central is a double image connection. If you choose single image connection, you will get 10 points. If you choose double image connection, you will get 20 points. Which you are choosing? See, single image, if you choose now, if you answer correctly, I will give you 10 points. Central, this 5 is 2 image. You should correlate 2 image and find out the diagnosis. 5, 6, 7, 8. 2 images have one diagnosis. 1, 2, 3, 4, 9, 10, 11, 12. One image, one diagnosis. Okay? So you are choosing which number? Ten, 9, 8, 7, 6. You will use your opportunity. 5. Choose one number. 4. So they are choosing number 3. So what is the answer for this? Diagnosis. So diagnosis correct only, I will give 10 points. And also I will reveal the image. If the diagnosis is wrong, I will not reveal the image. So we are saying church. Diagnosis. So I'll give you 15 seconds. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm sorry. So see other teams. If your turn comes as a first place team, you could choose this same image also. Because if you open the image only, you will get the big picture behind. So the idea is reveal the big picture behind. Okay? So you could try this. So second round. So the second round is So round 2, who is number 1? So the basic idea of Oppenheimer is who is number 1, Alice or Nazis? Okay. So that's the basic idea of creating Oppenheimer. Oppenheimer has justification for finding out atom bomb. Okay. So this round is about a number game. Okay. So this box contains 8 balls. Okay, of 4 pairs. Okay. So two balls will be of same color. So totally 4 colored balls will be there. So each team should pick one color ball. Okay. Each team should pick one color ball, and they will be given a question. If they answer it correctly, we will give the next color ball for you. Okay. You can correlate 2 color balls and you can give a diagnosis. Can you get me? So start from team D. So team D. So you could choose your first color ball. Okay. Team C, you could choose your color ball. See, you should not choose blue. You should not choose blue. Team B, you could choose one color ball. Team A, you could choose one color ball. Okay? Okay with this? Fine. See the rules. So now all of you will be shown a video followed by questions. Okay? You should write down the answers in the paper provided. If you answer at least one of it correctly, you will be given the next color ball. So for example, if one color ball is having number 1, the next color ball is having number 1. So HPV 11. You could correlate 1, 1, HPV 11. Similarly, you should correlate the numbers that you got. Can you get me? So, for example, if both the color balls read 1, 1 now, so HPV 1 is what I am trying to convey. So you should find the diagnosis is papilloma. If you answer it correctly, you could get more points. If you don't pick it now, you could move on to the next one. Okay? Fine. So this round has 2 steps. Step number 1 is picking the color ball. Step number 2 is listening to your story and answering the question. Okay? Fine. So shall we start? Shall we start? So all of them will be given one video only. So at the end of the video, you will be given questions. You should answer the questions. Okay? So watch this video. At the end of the video, I'll ask questions. That's the video. Okay. So now so 60 seconds for answering. All 40. Your patience for this video. So what is the surgery done here? What is the surgery done here? What is the position of the patient? What is the position of the surgeon? Kindly write it down within the 60 seconds. Please don't ask for extra time. Please. Within the 60 seconds, you should answer this question. But please. Time up. So please give up the papers. So the first question answer, tonsillectomy. The Second question, Rose question. The third question, I am expecting whether the surgeon will stand and do the surgery. See, it's not a... I have sit and do the surgery. Okay? So if you write stand position now, you will be given 10 points. These two teams. The answer sitting question. Okay, sitting question. So those have written sitting now, given points. So team A 30 points, other teams 20. Team B 10 points, other two teams 20 points. Okay, so now I'll start with team D. You will be asked a bonus question from these four scenarios. Okay, so if you answer that question correctly, you will be given 20 points. If you don't answer correctly, it will pass out to the next team. That team, if they answer correctly, 10 points. The pass will be to the next subsequent team. It will not be going all around. Okay. So all the four teams can collect their balls. Okay. So if you guess a diagnosis with the given balls, you will be given 80 points. Okay. So the number for team A is 6 and 5. Okay. The number for team B is 9 and 9. Number for teams 1 and 2. Team D 7 and 0. 0 means you don't count that. Okay. You will have only 7 as the clue. Okay. So you could correlate these points. I will give you a chance. If you guess some diagnosis, you will be given 80 points. Okay. Fine. So team A, are you guessing anything? 10 seconds for you. Only one guess. 10 seconds. 10, 9, 8, 7, 6, 5, 4. Wrong. 10 seconds for you. No 90 points. So team B, malignant otitis externa. Why? So they have received number 9 and 9. Why? So technetium 99 is a diagnostic scan for malignant otitis externa. So team B is getting 80 points. Okay? Team B is getting 80 points. Team C, 10 seconds for you. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Team D, 10 seconds for you. I'm sorry, you are complicating too much. Simple thing, wrong answer. So, we'll finish with this, okay? Now, okay, so apart from team B, other teams has a second chance. You will be given a clinical picture. So looking at the clinical picture are some picture relevant to that particular diagnosis. Okay, if you tell the diagnosis correctly, you will be given 40 points. Okay, I'll start with team A. Team A. Five, six. So the number is 57. Don't prompt answer. So this is a clinical picture of that particular diagnosis. So they spot on with an answer. So it's a petrositis or Gray-Negro syndrome with 5th and 6th nerve palsy. Okay. So this is a complication of CSOM. Okay. So this question they are getting 40 points. So 5th nerve palsy with 6th nerve palsy with diplopia. The clinical picture was diplopia. Okay. So team C, you are getting 1 or 2. 1 or 2. So look at the picture and think of a diagnosis. Sorry? Are you guessing any? 10, 9? Sorry? Okay. You are spot on. So it's seal like barking cough. Okay, seal like barking cough. Seen in? The reason for number 1 and 2? It's easy. Just think. I'll give you 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So 30 points. Okay. So they didn't guess the numbers correctly. Para-influenza virus 1 and para-influenza virus 2. So 1 and 2. Okay. So number is 1 and 2. Barking seal like cough. Scenic acute laryngotracheobronchitis, otherwise called croup. Okay. 7 and 0. See, at the end of this round, one team will be eliminated. Okay. Okay. I need a diagnosis. It's not that's not a diagnosis. It's one of the symptoms. I need a diagnosis for this condition. Okay, you will be given next clue. Okay, if you don't answer this now, you will be given next clue, but you will get only 20 points. So they're telling it as spatial palsy, Bell's palsy, but I need some more. That's not the diagnosis. It's one of the feature of this disease. Sorry. So the next clue for team D. Okay. So this is Justin Bieber. Okay. He was suffering from this disease. So it's caused by latent reactivation of herpes zoster virus. Now if you guess correctly, you will get 20 points. Now if you guess correctly, you will get 20 points. So Nansen syndrome is the correct answer. Okay. Justin Bieber was suffering from Nansen syndrome. He was cured for the same. Okay. So at the end of, so which team scored maximum points in this round? Team B, how many points? 80 points. Okay. So let's reveal the big picture. See, you got two options. Okay. You could choose either two image or two single image or one single image or two image. புரியுதா? 12 image இருக்கா? 1 to 12 நம்பர்ல ஏதோ ஒரு choose பண்ணிக்கோ. ஏதோ ஒரு choose பண்ணலாம். அது double image ஆ 20 points, single image ஆனா 10 points. ரெண்டு டபுள் இமேஜ் சூஸ் பண்ணா அப்படினா 40 points கிடைக்கும். சரியா? So big picture. So the big picture for you. So no one has opened the account. It's a golden opportunity to open 2 pictures. If you open two pictures correctly, see, you don't look upon easy image. If you open at the center now, you could have a good view of the clinical picture behind. Okay. For example, the 12th one is easy now. You have no use choosing that. Okay. So think and answer. So don't take too much time. Okay. I'll give you 15 seconds. 15, 14, 13. First you tell the numbers. You're choosing. Ready to choose for me. They're choosing 7 and 10 and 11. 5, 6. 7 double image. Number choose 10. 7 and 10. Okay. So 7, what is the diagnosis? I need spot diagnosis. Okay. So 7, they are spot on with the answer. It's Pott's perfect tumor, 20 points. Okay. Number 10. Number 10, what is that? So cartwheels and ASY. Okay. So wait, I will disappear that two images. You could guess the big picture. Okay. Those two images have been vanished. Now you will get some idea about the big picture behind. So two images have been fed off. Okay. Are you have the right to guess something. Okay. Are you going to guess something? I will give you 10 seconds. You are taking too much time. Okay. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3. So they have guessed it as tympanic membrane perforation. It was not correct. So you don't get the big picture. So shall I get the points table? Points table, sir. So the points table. I'm sorry, team D is on 85 points. Team A is on. Team C is on 90 points. Team A on 95 points. Team B on 135 points. Okay. I'm sorry, team D, I can't continue with you. Okay. So you are eliminated at the end of this round. Okay. So we'll start the next round with the three teams. So we'll have an audience question. Okay. So those are answering correctly are subjected to getting the gifts based on decision by sir. Sir, correct answer பண்ணா gift கொடுக்கிறது கொடுக்காதோ. So it's a connection image. Okay. So there will be 3 images projected. Okay. Kindly raise the hand and answer. Okay. Don't prompt. Okay. these three images reveal only one clue. Okay, the first image, so this reveals one clue. Okay, so two clues are there. The first picture has one clue. These three picture has one clue. Those who are answering correctly will get the gift. I have confirmed it now. Audience, anyone from the audience? Any guesses? Please raise your hand and give a guess. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm sorry, I can't give it for you. The first one is unilateral. Okay. The second one is what? What? Interval. So unilateral involvement of a disease, and it will have a interval surgery. Now can anyone guess? Guessed it correctly, sir? It's a peritonsal abscess. You could treat the disease and you could do an interval tonsillectomy at later stage. Okay? So interval tonsillectomy and unilateral involvement of tonsil. Okay? Fine? So now we go to the round 3. We'll go to the round 3. So this, the reason for Oppenheimer hit in India is this one. So it has reference from Bhagavad Gita. What reference? So now I have become death, the destroyer of worlds. This is a picture and quote from Bhagavad Gita. So this round is an important round. You will have 2 steps. Okay. First steps, you will be given a meme. Okay. Okay. You will be given a meme from a Tamil movie. Okay. If you answer the diagnosis with that meme itself, you will be given 80 points, like last round. If you answer it with the quote given at the base of the meme, you will be given 40 points. Okay? So, you answer it correctly or wrongly, you will be getting the next step, a story. So, all the three teams will be given a story, some imaginary story with lateral thinking with the diagnosis of ENT. Okay? For example, some imaginary story, the story will be having a diagnosis, not directly, it's an indirect depiction. Okay? So at the end of the story, you will be asked some questions. If you answer the questions correctly, you will be given 50 points. Okay? For answering the questions as well as finding the diagnosis. If you find only the diagnosis, you will be given 120 points. Okay? Shall we start? So we'll start from team C. So, first there will be projected a meme from a Tamil movie. Okay? Hope all are Tamil, right? Okay. So this is the meme template. Any diagnosis? This is the meme template. Any diagnosis? So 10, 9, 8. I'm sorry, they didn't answer it correctly. Okay? So you will be given next. Any diagnosis? Any diagnosis? I'm sorry. You just look into the code. I'm sorry, you answered wrongly. It is the easiest of this round. You have messed it up. Okay? Now, and the team B, so team B, Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1. So, and next slide. If you answer correctly, you will be given 1. 15 seconds for answering correctly. 15. So rhinosport is correct answer. 40 points. Answer is rhinosporiosis. Okay. Fine. So team A. So it will be toughest, okay? It will be toughest, okay? If you have read the theory correctly, you can think of this, okay? It's not a diagnosis, it's a phenomenon, okay? It's a phenomenon occurring in a disease. 9, 8, 7, 6, 5, 4, 3, 2. Sorry. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Sorry, that's not autosclerosis. Okay, I can't tell the diagnosis because still your story will be based on that only. Okay, fine. Team, you want to get? So you have to get in the story first. So the story for read the story carefully. You have to answer the questions at the end. An aged farmer who has a rich family heritage of fruitful farming right through the year, credit to his organic fertilizers and perfect utilization of water resources from the vicinity, he had a big cement storage tank where he used to store the water, which was maintained by a maid. Until the presence of maid, there were no problems whatsoever. Once the maid left the job for some personal problems, the farmer started to keep the lid open during the rainy season so that the raindrops can also fill up some water. But strangely, he noted fall in water levels during those times. Despite the rainfall was good enough, why there were fall in the water levels? See, compare this with the mean image, okay? It is tough, but you should somehow find out. It is a phenomenon even in your thinking, okay? It's the most common disease. At least tell me some diagnosis. Story enough for you? Have you understood? Shall I project the questions? So, story with you, diagnosis questions. Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1. So why the water levels kept decreasing? Now compare that with ENT. Absence of a lid-like thing will amplify the loss. What is that lid-like thing? What is the loss? What is the phenomenon? So it's your chance. So the phenomenon is round window shielding effect. Correct. What is the lid-like thing? Lid-like thing. What is the loss? What is the lid-like thing? See, you think of that story. No lid, water levels come down. Lid is there, water levels will be there. So, which is the lid here? So, tympanic membrane is the lid here. What is the loss? So, the hearing loss will be conductive hearing loss. Okay? See here. Next slide. So it's a round window shielding effect. See here, in an intact tympanic membrane, there will be conduction of sound only to the oval window. If there is a big perforation, if the sound reaches both oval window and round window, there will be still more amplified hearing loss. Okay? To avoid that, naturally, if the ear discharge shields over the round window, the patient for some time will feel that his hearing loss has reduced. Okay, so reduction of hearing loss due to ear discharge seen in safe type of CSOM, it is round window shielding effect. Okay, so the beam template, the upper thing is for whole window, lower thing is for round window.
இது மூவன் சர்வீஸ் சார் பெருசாக
So team,
இருக்கிறது ஆண்டனி சர்வே இது ரெண்டும் அழகுடிகள் சார்
பாயிண்ட் சொல்லல.
ஓகே
டயக்னோஸ் மட்டும் கரெக்ட். எல்லாமே கரெக்ட்.
இது ஆண்டனி சார்
So 50 points.
பெருசாக ஆண்டனி
So I welcome respected Sindhil Ganda ma'am to our event. Okay, she is the HOD. She is the professor and HOD of Kanyakumari Government College. Welcome ma'am. So team R. So you have already found out the diagnosis. Okay. Native lads were always renowned for their wide skills apart from the conventional reading from the schools. Though they had a lot of skills to name, swimming is the noteworthy among the other extracurricular interests because city dwelling kids hardly get to swim at natural brooks. Whether the country kiddos decide to go for a swim, the place of water never mattered. Be it a river or a pond or a lake, they will dive straight away. Over the passing years, the rivers dwindled, lakes became shallow, and the ponds were their only hope to swim throughout the year. Ironically, the ponds became the hub for all sorts of waterly activities. Women washing the clothes to men washing their buffaloes and so. Okay? So you already found out the diagnosis. Now we have to answer the questions. Next slide. So river, ponds or lakes, does the source of water matter? Yes. Why? Count down. River, pond or lake? Which one? 10, 9, 8, 7, 6. Do you have lake in your village? Okay, I can't give it for you. If the teenagers continue to swim, what will happen? It's the diagnosis. They will get sinus produces. If my family had settled down in a city way back, I used to go to the countryside swimming only during annual holidays. So I swim in a pond only once or twice in a year. Will I get the disease? So chronic exposure to the pond water somehow get the spores into the nasal cavity that will chronically lead to a disease called rhinosporidiosis caused by Rhinosporidium seaberry. It comes through the cow dung. Okay? So you'll be getting 40 points. 40 points. So team C. Pray such enclave chest. Prayer such enclave chest is always special. One fine morning, time is 10 past 9. The priest started preaching word from the Bible, verse 6, clause 20. At that moment itself, I became apoplectic and started staring at the stunning architecture of the medieval church. Roof is the center of the attraction where the arches were high. All were dull during the entire session, but why am I even here? A foreseer me who used to peep into the church just to amaze at the Santa Mass. I have my own reasons for today's prayers. Yes, just after the session, I crossed the crowded people down the alley, somehow reached the launch outside the operation theatre, then heard that tender sound which came out. Yes, it's an angel, deeply mesmerized by her beauty, skin all painted in rose. Okay, I just pinched the baby's skin to feel the tenderness. Okay, I refer this is some special feel. Okay, this story has 15 points for diagnosis. 15 words are directly associated with our diagnosis. I want you to write down 5 words. That 5 words should be pinpoint. For example, if you write it down 6 and 20 now, it should have some meaning to our diagnosis. You can write it down. So 15 points for diagnosis from this story. You should write it down at least 5 points. You could write it down anything, but you should correlate that. $30 seconds. Next slide. So kindly tell me the 5 points. So you write it down, right? Okay. So what is the diagnosis? Adrenal hypertrophy, correct. What is the complication of the given condition? This is also given in the story. Apart from the adrenal hypertrophy, we are having another complication which is also mentioned in the story. Ten, 9, 8. So serious ultimate correct. First one, tell me. Sorry. Roof. Roof for? Okay, next. Dull. Okay. Tenderness. Rose for? No. Next. What? What? Which is called high arched palate. So all these are features of adenoid. We call it as adenoid facies. Next slide. So Sinclair Thompson, referred air pain, 10 past 9, 9th and 10th supply the adenoid, 6 for physiological enlargement of adenoid up to age 6, class for amyloid classa, 20 for complete disability by age 20, aprosexic, lack of concentration symptom of adenoiditis, roof of nasopharynx, arches were high, dull adenoid faces, mask, crowded teeth, rose position in tonsillectomy, pinched nostrils, SOM for serious auditory. All these are given in your Dingda textbook. Okay, 15 points. Okay, so 5 points. Okay, points please. One team will be eliminated at the end of this round.
இது 3 parts.
சரி ஓகே. நம்ம கலர் சொல்லியிருக்கோம் 250
Team B has 145 points, Team B has 215 points, and Team C has 140 points.
So team C, I'm sorry, you played well, 140 points. Team A 145 points. Team B 215 points. So I'm sorry, Team C is eliminated. So two chances to open the big picture. Okay, the winner of this round is in the round. Team B. So Team B. So Team B is again getting the chance for big picture. They are having huge luck today. Fine. So big picture comes. So at the end of round 3, you will have 3 chances. Okay, you could choose 3 pictures. Six, 2, and 4. 4. Okay. 2 for Russell's bodies, rhinoscleroma. 4 for picket fence fever, lateral sinus thrombophlebitis. 6 is Queen C. Okay, 40 points. So let me reveal the big picture. Okay, let me reveal the big picture. Are you guessing any answer? I need the correct pinpoint diagnosis. Okay. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You can't guess. Very correct. I'm sorry. Okay. So team C is getting a chance to choose one picture. Okay. Sorry, due for you. Okay. Team C, you could choose one picture. You could get the points. Okay. So that point, if they guess only the connection correct and if they exceed you, I will not take it. Only if they choose the picture correctly, they will have a chance. Okay. So you should choose one connection picture. Okay, no connection picture. I will give you a chance to tell the diagnosis. I need the exact diagnosis. Serious oddities media is the wrong answer. Okay, I'm sorry, I can't give it for you. Team C is eliminated. So if they have answered correctly now, they would have got 160 points. Okay, they have lost the chance. Okay, so team round 4, well played, Team C. So the last 2 rounds decide who is the winner. Okay. So the fourth round is chain reaction. So atom bomb is based on nuclear fission, which is based on chain reaction. Okay. So one leading to another. Okay. One leading to another. So the clinical diagnosis is also like that. So if you are clear with next. Okay. Chain of reactions are from a proper history, in-depth clinical examination with appropriate equipment, ordering a correct investigation, and then planning for treatment. So all of these chain reaction, if it happens correctly, you will get a correct diagnosis. If any discrepancy anywhere, you will not get the diagnosis. Okay? So you're having 4 steps in this round. Step 1, you will be given a clinical scenario. Okay? You will be given a Google Assistant. You could ask the Google Assistant for extra history. Okay, you could ask the leading question correctly. It will answer yes I have or no I don't. So your question should be pinpoint pertaining to your diagnosis. Okay, step number 1. Step number 2, you will be given a 3-dimensional model. Okay, you could examine that model and you should clinically find the diagnosis. Okay, fine. Third step, you should order an investigation. Step 4, you should do a procedure on the clinical model. Okay. So, next slide. So, clinical history, 20 points. 20, 30, 20, 50. Okay, ready? So, okay. All will be basing upon only one diagnosis. One clinical history. Okay. So I don't ask the diagnosis first itself. First, I need a correct history taking. If you should ask a correct history for the patient. If I am convinced that your history is correct, I will give you points. If I am convinced that your examination is correct, examination points are correct, I will give you 20 points. Finally, only diagnosis comes. Okay. clinical history. Okay. So you should look into the clinical history. You should ask. You can ask 3 leading questions. Okay. If the leading question is correct, I will give you 30 points. If it's irrelevant to that diagnosis, I will not give you points. Okay. So step 1 for team 1. A 5-year-old boy brought to the physician for left history. He has a runny nose for the past week. For the past 2 days, he has intense pain on his left ear. Intense pain on right ear. He seems to have trouble during this routine. The boy has received all recommended vaccination. Recently started kindergarten. Pressure is normal. Pulse is 110 per minute. You can ask your lady question. Right ear. Only right ear. Elaborate. So you can ask a leading question, please. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So do you have ear discharge?
Yes, I have.
Sorry.
No, I don't.
No, I don't. Any other question? Time, sir. You can ask 3 questions totally. I'm not convinced if this one is okay for me. 10, 9, 8, 7, 6.
No, I don't.
Any other? Okay, time is up. History of swimming pool or like that.
No, I don't.
So, no, I don't. So, no history of swimming pool, no history of dysphagia, no history of ear discharge. Okay? Fine? So, these are okay. 31st. So, clinical history for team. So you will be given a history. Okay? A 16-year-old boy comes to the emergency department due to sore throat and fever. He started having a mild sore throat after returning from summer camp about a week ago, and it has worsened in the last 2 days. The patient also has right neck pain and earache, but no cough or shortness of breath. He does not use tobacco or illicit drugs and is not sexually active. Temperature is 102 Fahrenheit. Blood pressure is normal. Pulse is 104. So I'll give you 15 seconds. You should shoot out your 3 leading questions. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4. This page, yeah, okay.
Yes, I have.
Any other question? If your question is correct, I'll give you points. You are wasting my time. 5, 4, 3, 2, 1. I'll not give it for you. 10 points. So, for team A, I am giving a 3-dimensional model. Okay? This is iPad. See, this model, I have created the findings. You should zoom in, zoom out, examine what the clinical history that you have, examine this particular model, and you should give me the clinical points. Okay? So this is a definition. So a depiction of pain over the ear. Okay, you could zoom in. So இதை click பண்ணாத, click பண்ணா போயிடும். Yes. சரி, ரொம்ப வேவடா போயிட்டுனா மேலே ஹோம் இருக்கும் பாரு. மறுபடியும் ஃபர்ஸ்ட்ல இருந்து வா. See, again he is having right ear pain. ஜென்ட்லா பண்ணு. When they peep through the external canal, they are seeing some reddish appearance. Now, this is the finding part. That's all. Okay, this is the finding. So I don't want diagnosis. I just want you to tell the clinical findings. I need 2 clinical findings. Congested tympan membrane, correct. Any other? Okay, it's a mild retractor. So 20 points. Patient with throat pain. So I will show you the So, so this is the clinical examination of the patient with the clinical history. Okay. So you can look at the appearance of the oral cavity and oropharynx, and you can tell the clinical points. Enlarged tonsils. Okay, fine. Number 2. 10, 9, 8, 7, 6, 5. Redness. Okay. Redness or congested. So congested. So congested tonsils. 20 points. PowerPoint better. Screen off பண்ணிக்கோங்க. So now I will give you a set of investigation. You should order an investigation. Order. Team. Team 1A. choose பண்ணி அதுக்கு validate பண்ணணும். ஓகேவா? So choose one investigation among this and justify your case. Audiogram, tuning fork test, impedance audiometry, cultural stereopus.
மேம் யாருக்கு எக்ஸ்ட்ரா மேம்?
Answer is impedance audiometry. How can you justify it?
ரேண்டமாக யாராவது ஆன்சர்
So
பண்ண
what is the diagnosis now?
அது நம்ம யோசிக்கல.
What is the diagnosis and how you are justifying it? ASOM. For ASOM, how are you justifying impedance audiometry? I can't give it for you. Team 3. So impedance audiometry is the wrong answer. Okay. So some ASOM leads to stage of suppuration. You should collect first from them. You should do culture sensitivity and you should prescribe antibiotics. Okay. So choose one investigation among this and justify your case. Answer please. Okay, examination, palpation, tongue depressor, which will give you. Okay, so this is not a case of acute tonsillitis. Okay, in the image, it was unilateral enlargement. It's not a bilateral enlargement. Acute tonsillitis, chronic tonsillitis, always bilateral involvement. So unilateral involvement. So diagnosis will be. So I'm wrong. So the answer is peritonsillar abscess. Okay, you should again try to do a culture sensitivity. Okay, if it's a chronic tonsillitis, you could use your tongue depressor and you do a Irwin Moore sign. But here you can't do that. I can't give it for you. Okay, that completes it. We don't have time for demonstration of video. So final round. So can I have the points? So be ready. Who is going to choose the big picture? This is the last big picture. At the end of this, I am going to reveal the diagnosis of big picture. Points, please. Team A, 195 points. 285 points. So which team has more points this round? Team A, right? So you have golden opportunity to increase your points. This is round 4. You can choose 4 connection image. Okay. So you don't choose already chosen one. Okay. 5th one, grazing a sign. Lateral syndrome is correct. Tongue sign acute epicarditis correct. 3 சொல்லிட்டாங்க. 2 சொல்லிட்டாங்க. 1 இருக்கு. 1 empty lateral sign. Latest enzyme, correct? Only one. Huh? Omega sign. Laryngomalacia. Okay, fine. So 20, 20, 40, 60 points. If you now reveal the, if you now tell the big picture correctly, you will get 160 points. You can easily defeat them. See, the picture is very clear. It is a ear diagnosis. I need pinpoint diagnosis. I'll give you 15 seconds. Okay, if you don't find out now, I'll reveal the answer. We'll start final round and finish off. Anyone from the audience? No? That's the main diagnosis. Yes, I give it for you. It's atelectasis. It is grade 3 past tensor retraction, atelectasis. Okay, it's based on what classification? SADA classification. Past tensor retraction, SADA classification. It's a grade 3 past tensor retraction. It is called atelectasis. Okay, you're spot on. 160 points. Okay. So final round, it's a rapid fire round, okay? 10 questions, 100 points. 1 minute time, okay? Okay, shall we start? Ready up? Team A ready up? So team A எவ்வளோ டார்கெட் எடுக்கிறாங்களோ அதை நீங்கள் பீட் பண்ணீங்கன்னா you could still have chance. படிக்க விஷயம் சரியா? போயிட்டு வரும். ஸோ ஸ்கிப் பண்ணிட்டு 6 seconds டைம் திருப்பி வரும். டோட்டல் 1 மினிட் ஆகும். டோட்டல் டைம் 1 மினிட்ல நீ எவ்வளோ Are you ready? சொன்னா போதும் சரியா? Are you ready? Time starts now. Other name for SOM. Correct. What is basalt abscess? Correct. Name one boundary of Pusak space. Scutum. Yes, correct. Bitmax theory. Correct. Surgical treatment of same type of CSOM. Correct. An organism that belongs to drip clade causes. You could pass the question. Correct. Causative organism of acute epiglottitis. Correct. Occipital-mental view of X-ray of paralysis signs is called. Correct. Name an instrument to arrest hemostasis in cortical mastectomy. Cortical mastectomy. I'm sorry. So 8 correct. 80 points. Okay. I will reset the timer. So team B, are you ready? Your time starts now. Other name for periodontal abscess. What is lux abscess? Name one boundary of sinus tympani. Sadis theory. So that is correct, okay? Sadis theory. Wrong. Surgical treatment of unsafe type of CSOM. Unsafe type of CSOM. Correct. Fish bacillus causes Fish bacillus causes. Correct. Causative organism of croup. "15-degree lateral way of temporal bone is called." Correct. Name an instrument to crush the tonsil at base of tonsil. Your dental surface correct. Lux surface you're wrong. Sinus tympanic correct. Sadis theory wrong. Unsafe type correct. Fish bacillus correct. Group correct. Last view correct. 60 points. So we are coming to the end of the quiz. So the points goes like this. Team A, Team B, 345 points. Team A, 495 points. So other three teams you played brilliantly. Sorry for that. So all of you prepared well. Thank you for that. But it's highly based on luck. Okay. Don't feel disheartened for it. You all played brilliantly. Okay. Thank you.
ஆமாம்மா
ஒரே தட்டில்
டெலிகேட்ஸுக்கு 3 ஸ்பீக்கர்ஸ்க்கு
இல்லை சார் ஒரே தட்டில் ஷாலு மொமெண்ட்டு கிஃப்ட்டு எல்லாத்தையுமே அப்போவே ஃபஸ்ட் டைம்
டீன் அண்ட் கோட்டு ஷால்
ஷால் மட்டும் டீன் அண்ட் கோட் ஷால் மட்டும் நம்ம விசிட்டிங் எப்படி மட்டும் ஷால்
சுபஜோதிக்கு ஷால் கிடையாது.
For more discussion, you can join my Telegram group. Okay. Fine. Thank you. Congratulations to the winners.
இது வந்து எக்ஸ்ட்ரா